We are heading into a holiday week, and COVID-19 is straining resources at Arizona hospitals, and health experts fear it's only going to get worse.
Some hospitals say they're actually limiting non-emergency surgeries, and now one Valley Health Group is taking a different approach to prevent hospitalizations. Our Elliot Polikoff is live in the newsroom to explain. Hey, Elliot.
Hey, Whitney. Doctors, nurses, and other health professionals have spent years at this point trying to convince Arizonans just how big of a toll this pandemic is having on hospital systems and other medical facilities. It hasn't always been successful. So now one medical nonprofit is going big, like full page in an ad newspaper big, to try to get the message out loud and clear.
We are doing everything we can, but we need your help. Those are the first words you see in the Health System Alliance of Arizona's full-page ad.
The Health System Alliance doesn't do this. We don't do a lot of advertising, but the point was hopefully to have some shock value, to have some awareness.
Awareness that Arizona hospitals are stretched dangerously thin, to the point that some of these medical facilities like Banner Health have had to put non-urgent surgeries on hold.
Our hospitals, our healthcare workers, our nurses, our docs, they're also fatigued, but this is still an issue. COVID is still here and it's still real.
And despite widespread vaccine availability, family physician Dr. Andrew Carroll is worried it'll only get worse.
What I'm really nervous about is that it is very similar to last year, where we had a very rapid uptick and we had 5-digit case rates, hospitalizations, and very high death rates.
The World Health Organization has already said the new Omicron variant is spreading faster than the still dominant Delta variant. While the documented Omicron cases in Arizona are still relatively low, with 6 cases reported in Maricopa County last week, Carroll says that number will inevitably rise, especially among one particular group.
The biggest concern we have with Omicron is in the unvaccinated. Of course, this is going to ravage that community. Right as we enter a holiday season and New Year's Eve, it really is a setup for a disaster.
Carroll says at his office, vaccine and booster shot appointments have increased in the last week. He and Kaufman are both hoping that travel, seeing family over the holidays, and yes, potentially that full-screen ad can convince anyone reluctant to get the vaccine to take the plunge, if not for themselves, for healthcare professionals.
Our goal is really, the predictive modeling shows that if we stay with our current hospitalization rates and the current transmission rates of COVID, we will have a peak in mid-January. So this is the timing, again, was important before the Christmas holiday and New Year holiday to just try to avoid that.
If this ad proves to be effective, Kaufman says Health System Alliance will do more of them, but seeing as this ad campaign cost about $30,000, she's not committing to anything just yet, Whitney.